Hello, everyone. I see some people are still joining, getting audio set up, but I see a good number of people, and we only have 14 minutes now, so I'm going to go ahead and get started. Welcome, everyone. This is our fourth and last brief 15-minute provider training. Today, we're going to be discussing improving your cultural competency in just a very little short burst. And this is a part of a series of trainings that we at Health Literacy Media are putting on for the Kansas City Health Department on various health literacy and specifically COVID and vaccine communication topics. And so Health Literacy Media we're a health communications group out of St. Louis. And I have my colleague Jeremy here moving the slides for me. Thank you. So this is me. I've been with HLM for 13 years now, given lots of trainings and met lots of people through them. So I'm really happy you're here, and I hope you find this training helpful. Before we begin, so ways to participate. I know it's really a short training, but if you would like to add a comment, if you want to ask a question, feel free to speak out loud or use the chat. We are monitoring the chat. And then at the very end, we are going to be pasting a survey in the chat. So please feel free to click on that, fill out the survey really quickly. And we'll also be sending a workshop summary that's going to cover all of our provider training topics. So we're just going to start with a definition of culture. There's lots of definitions out there, but this is a really simple one. So it's a large, diverse set of mostly intangible aspects of social life. So kind of a vague definition on purpose. More specifically, it's the values, beliefs, systems of language, communication practices, and objects that people share in common that can be used to define them as a collective. So we can think of culture in lots of different ways. We also know that culture influences our health. So the ideas we have about health, the languages we use, our health literacy skills, and the context in which we communicate reflect our culture. Communicate about health, reflect our culture, and vice versa. So as we're going through, typically here we have a little discussion around culture and how this comes into play in your work. We won't have time for a discussion today, but we encourage you to think about, as we're going through this training, to think about what cultures are represented in your clients, your communities that you serve, your organization that you work, and in your own personal life. And how have you adjusted your work to meet people where they are, people with different cultural beliefs, cultural practices? Have you created new programs or new processes to help meet them where they are? So just something to think about as we go through. So here are the three topics we're going to cover today quickly. Reflect on your own culture and potential biases is our first topic. So anytime we're talking about, and Jeremy, you can move forward. Yeah, anytime we're talking about culture and bias, the first step is to reflect on your own practices, your own culture. So this is a nice way to do this. Again, in a longer training, we do this together, but this is something you can do on your own. You could do in a group at your place of work. And you can envision your culture in these kind of three levels. So you've got your roots, which is your origin, your sense of belonging to your cultural group. It could be your race, it could be your ethnicity, what you identify with strongly. The trunk are the values you identify with or that you value in your life, such as family, loyalty, discipline, working hard, hard work. And then the leaves at the top are the visual signs. So the language you use, the clothing you wear, symbols, just kind of how you go about your daily life. So we can think of culture in these kind of three different levels, and it's going to be different for everyone. It's just a nice framework for reflecting on your own culture. A big piece of reflecting on your own culture is this idea of cultural humility. So this is a process that's not ever, it's not an endpoint. Like you're not going to reach the point where you can say, I am culturally humble. It's dynamic. We are in certain situations and at certain times in our life, and sometimes we're less. But it's the process of reflecting on our own bias, our own privilege, how to deal with power imbalances, how to keep an open stance with others about their cultural identity. So it's really complex, but it's this process of learning and a process of practice. When we're talking about cultural humility, a big piece of that is your bias. And so in the last couple of years, you may have heard more about implicit bias, especially around policing. But it is our attitudes and stereotypes that affect our understanding, actions, and decisions in an unconscious way. So even if we feel we are really educated and we do the work, we still have implicit bias. We all do. So here's the difference between explicit and implicit. Explicit is intentional and expressed. So a sign that says whites only, stating women with kids are not as focused on their careers. That is explicit bias. Implicit bias is maybe there's a property manager that just does a little more extensive checks on Black applicants compared to white. So it's not that they're saying it, but it's in something they do. They might not even realize they're doing it. Not promoting women with kids, choosing someone over a parent, not just women, but a parent with children over someone, choosing someone without children over someone with children because you have this implicit bias that you might not be aware of. And so here's a cool little tool. This is called Project Implicit. The website is down at the bottom, and this will also be in our resources that we send out. It's a really cool website that takes you through a test where you have to move quickly and you click through a series of pictures and images, and it gives you a score at the end to test your bias. So you make decisions based on what you're seeing. And it's really fascinating. If anyone has taken that, you'll know that it can be surprising what you'll find. So we recommend that, taking that, bringing that back to work as an exercise as well. Building your cultural competence. So this is reflecting on your own culture is a piece of building your own cultural competence. What we have shared today, and Jeremy, you can move forward, is that this is a process in and of itself. So it's when we continue to become more aware of our own and others' cultures specifically, and learning skills in cross-cultural situations. So to be cultural competent does not mean that you're an expert on all the cultures or that you know exactly what to do in all situations. It's a process. So it's about educating yourself. It's about continuously learning. It's about adapting your services, your processes, your thinking, your conversations. There's a wonderful training online that I highly recommend on Think Cultural Health. And that is a federal government site. I believe it's from the Office of Minority Health. And it is a wonderful training on cultural competence, bias, cultural humility that I highly recommend. There's cultural backgrounders you can use. We don't want to rely on these, of course. We want to talk to people and learn from them and learn their experiences that are all unique. But if you know, for example, you're going to be working with a specific population, maybe you're working with Afghan refugees that are coming in, learning a little bit about their culture, doing some reading on the history, on the health conditions that are common in their country or their area, where specific populations are from, what are the religious issues, if there's any combat or things around religion or subgroups, minorities, really helpful to know before you interact with a group. And again, not using that as your, as an absolute, but using that as a guide. Okay, I can store some of that and know that there's that context. But then, of course, each person is unique. There's lots of sites like that that give you some background information. That CDC one is just one of them. We can't talk about culture without talking about the class standards. And so these are nationally set standards that are intended to advance health equity, improve quality, help eliminate disparities by establishing a blueprint for health and healthcare organizations. So this is more for at the organization level. What are the ways you can implement these standards to make sure that you are providing culturally and linguistically sensitive services? So really great. It's also from that same website, Think Cultural Health. Really great set of standards that you can then build on. And the principal standard being providing effective, equitable, understandable, respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, other communication needs. So it's vast, it covers a lot. And, they're kind of large topics, these domains listed here, these 15, but there's a lot underneath each one you can do to build, even just to take small steps in your organization to be more in line with the class standards. So just a really great tool. Lastly, we have 3 minutes. I think we can make it. Lastly, working with interpreters. So here's a more practical tip for something you can take away right now. I don't know if any of you have worked with interpreters or work with interpreters on a regular basis. There's things you can do to prepare before, things you can do during a visit, and then things to do after a visit. So before the visit, you want to learn as much as you can about your client or your patient. What are their needs, preferences, their culture, their religion? What are some common practices? It's helpful if you can work with the same interpreter if you're going to see someone multiple times. It's not always an option, but it's ideal. Scheduling extra time, because there has to be time for your client to speak, the interpreter to speak to you, and then for you to clarify things and make sure you're understanding correctly. So each conversation takes sometimes double the time it would with someone who speaks your same language. And then talking with the interpreter right before about the case or the situation. Here's what we're going to be discussing. Here's some information you need to know so that they're prepared. During the visit, of course, introducing everyone so that the person knows who this interpreter is. Where sometimes people want to know where they're from, what language they speak, what dialect. That can help them feel more comfortable. Sitting so that everyone can see, so sitting in a triangle or a circle so that you're like in a group speaking. I also mentioned you always want to look at the client or the person who is speaking, not staring or talking to the interpreter. Keeping your sentences short and kind of short bursts as opposed to long paragraphs. And then redirect. So sometimes the client and the interpreter will join into a conversation together because they speak the same language. So they start speaking, but it's your job to kind of redirect as needed. Okay, I hear you are speaking about something, remember, I can't understand. So can you tell me exactly what you're talking about? And I just speak from experience. I'm also a mental health provider working with refugees. So I spent a lot of time working with interpreters with different refugees from all over the world. And these are common practices that come up. And then lastly, after the visit, debriefing with the interpreter can be so helpful if you have the time. They can tell you little subtleties that you may not have noticed. For example, we don't ask directly about that in our culture. So when you ask that question, they got uncomfortable, or I noticed they were looking down at a certain point. I think they felt maybe some shame about something. Gives you a lot of great input that you might not pick up on because they're cultural subtleties, linguistic subtleties. So if you have time, it's a great practice to debrief. We are at time. I know that was a lot of information. I hope it was helpful to you. Tons of resources here, which we will put on our summary. We'll have a bunch of resources for you. I highly recommend that Think Cultural Health website. That's probably my #1 resource to share. So thank you, everyone. I am going to paste the survey in the chat. If you have a minute to fill that out, we would really appreciate it. And thank you, everyone, for your time.
Thank you. Great.